I was the only woman in the world losing my hair in my 20s, and every pregnancy just stole even more nutrients out of my body, and my hair just kept falling out. I thought I was going to be wearing a wig by the age of 30. And I was using a red laser cap, and probably the only one that was on the market back then. It was, 25 years ago. But I actually think it worked. And I now know, I'm sure the technology is 1,000 times better today. So why don't you talk about the different biohacks, the exciting stuff, the technologies that people can use, and that hair loss, like I'm laughing at my son when he's complaining about, worried about his hair. I'm like, do you understand what's at your disposal for your hair? This is not going to be your issue. You're going to be totally fine. You're going to have a full head of hair regardless, because there's so much out there. So let's get into the exciting stuff.
Yeah, it's so true. I mean, the changes and advances in the world of hair restoration have just been coming fast and furious, and I think it's going to continue. Way back when, no one in medical school taught me that red light had any kind of effect on a hair follicle, much less any organ system in the body. Well, the only thing I knew about light being turned into energy was photosynthesis, and from what I knew is that it wasn't going to happen in a human. But later on, I discovered that actually red light can have a powerful effect on organ systems. It can increase blood flow, decrease inflammation. And we know now how well it can affect hair. So if the follicle's dead and gone and it's beyond repair, the DHT has killed the follicle, it's not going to produce a hair again, it's too late for red light therapy. But if you're in the early stages, if female pattern hair loss in particular does not typically result in baldness, usually it's a diffuse thinning or a weakening of the hair follicles. So women do very, very well in the early stages of hair loss with low-level laser light or photobiomodulation, red light therapy. And so do men in the early stages of hair loss do very, very well with light therapy. Red light has no side effects. It is completely pain-free. And yes, the devices have changed enormously over the years, so much more powerful. But also, we have so many more knockoffs and watered-down devices in the industry than ever before. I mean, if you think you're going to get if you're going out shopping for a TV, if you think a $5,000 TV is the same as a $500 or $400 TV, I mean, seriously, you need to check yourself, because electronics just don't work like that. You need to invest. If you're thinking about a laser, try to get a good quality medical grade laser. That means one that was designed by physicians or PhDs, tested clinically in a clinic, and also under the guidance of a physician, so that we can actually track and measure your progress over time. So one of the things in the office that we do upon an initial evaluation is we put a camera on your scalp, and we can actually count the hairs with the AI-powered microscopes, give us density and hair caliber measurements. So this is a very powerful way in many different areas of the scalp to get a sense on what's happening in some of the bellwether areas. And then we also physically measure a hair bundle in each different zone. So a lot of women complain, oh, my ponytail is shrinking. Well, what if you made a scientific ponytail in 6 different areas of your scalp, and you could see how those ponytails were changing over time, either getting better or staying the same, or God forbid, decreasing? Those are the kinds of measurements that we do when we're tracking our laser therapy patients. So the Bauman Turbo Laser Cap, that's the premier device. It's portable, it's powerful, it's got over 300 diodes, it covers 25% more area than any other device on the market. And it was designed by Dr. Michael Rabin, originally, the original inventor of the laser cap, which he designed back in, I think, 2008 already. Been some time. So 20 years ago, maybe you had one of the originals from Cleveland.
I was trying to think. Maybe I did.
It's possible. But the new one is completely collapsible and portable, and you should take it with you, obviously, if you're traveling. And it's just 5 minutes a night. And patients often say, well, how quick am I going to see results? Well, it's not an overnight bit of business to grow hair. Laser light therapy provides energy to the hair follicle through the mitochondria. When red light hits the mitochondria, it creates a chain reaction of anti-inflammatory processes and also energy production in the form of ATP. ATP is the currency of energy that the cells use. So remember, we spent a lot of time talking about how hair follicles are highly metabolic. But what if they're weakening? What if they're not producing enough hair or thicker quality hair? They're getting a thinner, shorter, wispier hair. If you impart energy to them and give them this surplus of energy, they're going to grow better hair. And that's how red light therapy works. But it takes time. We can measure results in about 90 days, see the results in the mirror in about 6 to 9 months, and see kind of the full final outcome of any treatment modality in about a year.
But even as you're saying that it takes that long to see results, just for me, when I change something for the better for my hair, I can feel it just sticking up off of my head a little thicker or just having a little more oomph to it. And no one else is going to notice, but just putting my hands through my scalp, I can feel it. It feels thicker. It feels more like it's got more life to it. So you will start seeing that. I mean, it's just like with your skin. I mean, if you have a day or two of eating horribly, you look all washed out and nothing really structurally has changed. You
Yep.
just have less circulation to your face and less life to you. So you will start seeing things a lot sooner than that. I personally would believe, but
I would assume that you, Sarah, and also those who are listening to this podcast are probably more on the sensitive side of things, meaning that they're just have a more, um, they're more sensitive to the changes that are occurring in their body. And so I would agree with you that certainly you're going to feel something. I notice that when I use the laser, immediately, first of all, I feel a little bit of warmth.
yeah,
Although the heat is not the trigger, it's just warm from the electrical currents actually going through that laser. But also, I notice the blood flow. I can actually feel the pulsations in my
yeah.
scalp. Those, there's probably thousands and thousands of miles of blood vessels in your scalp, and they all start to dilate when you use red light therapy. So even if you don't have hair growth that first day, please, you're not going to have hair growth that first day. You're already increasing the blood flow to the area. You're increasing the oxygen. You're increasing the nutrients and fuel. You're turning on the sprinkler system to the garden, and you're shining a light on that garden, and those follicles are going to respond. It just takes a little bit of time.